the end of all of it is, what do you want your legacy to be? And so for me, I want to create an army of servant leaders. That's my goal.
Don't conduct your analysis in isolation, because data is so incredibly powerful.
Not defending just the tribe, but defending the organization.
Those creative people that you really want to keep empowered, keep excited, keep motivated, keep thinking.
A good experience pays dividends down the line.
Stereotypes tend to break down in proximity.
Welcome to We're Only Human, a podcast about human resources, business, technology, and the workplace. My name is Ben Eubanks, your host, and I'm so glad you're here. Hey, it's Ben Eubanks. Welcome to We're Only Human. I'm so glad you're here with us, and I'm excited for the conversation today. Today's episode with Kellee Webb is going to really dive into some of the things that they're doing over at Cenikor to really connect with their people, serve their clients, and create a better impact on the world. I know it's going to be inspiring for you because I couldn't help but be excited and inspired, and I've known Kellee for quite some time now. She was one of the people that actually commented on some of the writing and some of the blogging I was doing very early in my career. And we've become friends over time. And I'm so grateful for her and for her influence and for her impact, not just on me, but as an HR leader overall. By the way, this is one of the episodes in our series with Insperity on small business HR, really looking at some of the key things that help teams stand out. And as you'll hear from Kellee, Cenikor is at about 600 employees. They're at that pivotal point where they're adding layers of complexity because they're growing, but they're also trying to maintain that culture of connectedness and support for all their people. So I'll get out of the way. Let's dive into this fun conversation with Kellee and hear some of the things they're doing to serve their clients through substance abuse programs and other great work.
So you were saying a minute ago that you started, how big was Cenikor when you started there?
So when I started at Cenikor in 2009, we were 82 employees. We had 3 locations where we did substance use and behavioral health treatment, and we were 8 total people in our corporate office. And we've grown over the years through multiple acquisitions, 12 to be exact. We are now almost to 600 employees, and we have about 75 people in our corporate office. We've changed a lot over the years. We've added services where we take third-party payers, such as insurance funders and VA and things like that, to help provide treatment. We've expanded the types of services that we provide in all of the communities where we serve. And so we've had to add a lot of back office support with revenue cycle, expanding our HR team, we created a call center where all of our admissions come into one location first versus someone calling directly to the facility. So we've wrapped a lot of back office support around our facilities where the care is provided. So definitely have had some growth opportunities.
Goodness. That's been an adventure for you, I'm sure, seeing that over time, because there's the excitement, there's the challenge and all the things that are involved in acquiring another company, bringing them together, trying to match up the culture where you can, trying to line up all the benefits. Like there's just so much in that. And to do it, how many times? What was the number of acquisitions again?
12.
12. Okay, 12 times. All right.
Mm-hmm.
That is tremendous. So back in 2009, were you the sole HR person or did you have somebody else there with you?
It was myself and one part-timer.
Okay. So, okay.
That was it.
It was like the Christmas party was me, myself, and I, plus our half-timer, just letting you get them in the mix. Okay.
And when we started, we were using, I won't name the payroll provider that we were using. I'd never heard of it before, but it was supposed to be single location, single state. And we were using it across 3 locations, and one of our locations was in another state. So like my first order of business, other than digging out of recruiting, because they hadn't had anybody in HR for about 90 days to 4 months, I started recruiting as fast as I could, and I started vetting for a new payroll provider right away, because I came on board in July, and our open enrollment was November 1st, and I was determined that we would not do a paper enrollment again, because they had been doing all paper at that time. And so filled a bunch of positions, got our new payroll vendor on board by the middle of October, skin of our teeth. But one of the things our CEO told me during the interview process is we are growing. It is a directive from our board. There is more need in more communities than we will ever be able to meet, but we're going to try. We're going to continue to try to provide more services in more communities, and we're going to continue doing so as long as it is economically viable for us to continue growing. And so with that in mind, I picked what I will call a Cadillac of HRIS system that I knew would be able to grow with us. And we've just been expanding ever since. And so a lot of the early growth really came with systems, putting systems in place, putting infrastructure in place. That's one of the things that I'm really big on is how do we use tools to make ourselves more effective? So AI has just been a huge blessing for our team. But how do we use tools and for us, maximizing our resources as a nonprofit is just part of good stewardship. But the tools can only do so much. You do need to add people as well. And so as we continue to grow, we put in place a leadership development program in 2012. And it's basically an annual program where we don't sit back and I call it cherry pick. We don't sit back and cherry pick who gets to be in the program and say, oh, they're doing great. Let's include them. It's an application process. The employees have to raise their hand and say, I want this. I want to participate in this. They have to tell us why they want to participate, what they want out of the program, what their career goals are, and then what they're going to give back to the mission as they go through this process and become a better leader. What are their ultimate goals and what do they plan to give back to the organization? So it should be this reciprocal process with leadership development. And we've been doing that every year since 2012. So
that is really incredible. I don't think I've ever heard a single program, big company, small company, any company out there that says as part of this, some of them have the application piece, things like that, but how are you going to use this to be better for the people that you're serving and taking care of here, right? Being a steward of the people as well. What are some of the themes that come out of that? What do people say in response to that prompt? Because I have to imagine you see some things in there that inspire you and get you excited as a people team.
Absolutely. Absolutely. And it is about 65 to 70% of all of our employees are in recovery themselves. So it is about not only stabilizing their future with the organization and their career path, but how they're going to give back to our clients. Because our clients, it adds a lot of credibility when they're coming in and they are working with someone who has walked the same path that they are trying to walk, and they can see that success that they want to achieve themselves. And so really a lot of the answers are about giving back to our clients. It's about giving back to the community and having that purposeful work. But it's also about being a really integrated part of the team. It is amazing. We have great team members. And when we do our surveys of our clients, our client satisfaction surveys, that's one of the highest marks that we get is just the caring and compassionate employees that we have and how they feel valued. Because a lot of times the clients that we serve, they just feel like I'm just a throwaway person. I don't have any value, and they feel valued. And so a lot of those answers are back to the clients, back to the community, back to the teams that we have.
It gives them a different level of respect, empathy, appreciation for both sides of that, right? The people that are being served, they see, hey, this person knows this problem. They're not just talking at me, they're talking with me. And the other side, hey, listen, I may have been exactly where you are, and you can get through this because I'm proof of that. And having that very frank conversation, that's really incredible. Do we even talk about that at the beginning? I think we might have skipped over the part. Cenikor, you do substance abuse treatment support. Talk about some of the things that you actually do, because I think it's an incredible mission that y'all are delivering value for. And y'all are based in Texas, I believe, correct?
Yes. We have locations in Texas, from Amarillo in Texas, and we actually acquired Farmington, New Mexico, which sits at a place called the Four Corners. And it is 4 different tribal nations that kind of come together right at the top of New Mexico, bottom of Colorado. And so there is a lot of need in that area, but we acquired them, I think, in 2022 and have just really brought more services to that community. They only had residential. We've opened detox, we've opened outpatient. But for us, it is about meeting clients where they are. And so we have detox, we have inpatient residential, we have outpatient, we have medication-assisted treatment to help with the opioid crisis, yes. And then we also just started something in the last few years called Recovery Support Specialist. And so our counselors, our nurses, the ones that are in treatment with the clients and support them in treatment, they can't acknowledge them if they see them on the street or in the grocery store in their communities due to HIPAA, due to confidentiality. But a lot of times our clients want to stay connected to us. And so recovery support specialists are allowed to meet them during treatment, and then they put them on their caseload, or they request to be on their caseload, and they can walk with them for the next 2 years. We ask for a 2-year commitment. If they need a ride to work, if they feel like they're about to relapse and want to meet for a cup of coffee, if they need work boots, if they need help with their resume. So it just extends, this individual extends the care that we're able to give. And then if they feel like they're about to relapse, or if they do relapse, they can come back to this person, and it takes down a lot of the shame and the guilt that comes, because this is a relapse prone disease. And so that person can help get them back into treatment, and they can go back to that caring, compassionate place instead of having to go someplace else because they feel guilt because they failed. And so it's maintaining that connection and letting them know it's okay if you're not okay. We can help you get back to that place. And so that's been really rewarding. We put that in place in the last 2 years. And it's really about providing that full continuum of care where no matter what services the client needs or whatever funding source that they have or don't have, we're going to be there. And that's one of the taglines that we've put in place for our organization is behavioral health for all. So if you have funding, if you don't have funding, we actually receive block grant funding from HHSC for clients who cannot pay for themselves. And so we're able to scholarship them and help them get treatment along with those that do have insurance. And so it's about meeting people where they are, whether that means where they are in their recovery or where they are with financially, or just looking at them holistically, not just this is your addiction and this is the only thing that you are.
So would you think, I've had this like little nagging thing in the back of my head I want to ask you. So would you think that a company that has a mission that's so service oriented, that's so concerned about the needs of others, it seems to me like that kind of company would have an HR team that reflects that. That is also service oriented, that's also concerned about the needs of the people around, not just here's the process, good luck with it, or here's the form, it'll explain everything. I'm too busy, but it's taking an extra step to be with someone, to support them, to love on them, just like you're talking about these counselors loving on someone who's going through a hard time. Do you think that's true? I'm curious. It seems logical, but I don't know.
Absolutely. No, it's 100% true. And we actually recruit for that, not only in the HR department, but in every department at our corporate office, which we actually call Facility Support Center, because our corporate office would not exist without our facilities. When I hire a new director, the thing that I tell them, when that facility calls you on Teams, on your phone, whatever it is, that is not an interruption of your job. It is literally your job to serve that facility employee, because they are serving our clients. We are here to serve them. So revenue cycle can be outsourced. Marketing can be outsourced. HR, I don't believe they would do as good a job as us, but it could be outsourced, right? Marketing has been outsourced. We have marketing mostly in-house now, but we still have an external partner. Our access center for a long time, we didn't have our call center, which we call our access center. It just went to the individual facilities. So literally, we don't exist here unless the facilities are successful. And our bonus system is set up that way. If our facilities don't succeed, we don't get our bonus. So our benchmarks are set up by facility. And if our facility, if we don't support them to hit those benchmarks, whether it's with the hiring and recruiting, whether it's with our revenue cycle, getting the authorizations that they need, if we don't support them to success, then we take a hit on our bonus as well. And that is actually completely fair. And so that's one of the things that, again, I think it comes from the top down. HHSC is our regulatory agency, and it requires everyone in our facilities to clock in and out. It doesn't matter your level. You have to clock in and out, so they have a timestamp of when you are in that facility or not. We don't have that same requirement at Facility Support Center, but because it's good enough for the facilities, it's good enough for everyone here. And so everyone all the way up to the CEO clocks in and out. Our culture is very much, we are all here to serve. The facilities serve the clients. Everyone here at Facility Support Center has purpose, and we serve our facilities. It doesn't mean we always get to tell them yes. Sometimes we have to tell them no. Sometimes we have to say, I know you want to move forward with the termination on this person, but we're not quite there yet. Here's how I can support you to success, whether success is helping to turn that employee around, or whether it is they don't turn around. And yes, indeed, we do have to move on to termination. But one of the things that we look for when we hire is humility. We actually have interview questions based on humility, searching for humility, and then intrinsic motivation, because we have to be intrinsically motivated to drive towards the mission, because we should all be pulling in that same direction.
I want to ask you like 15 more questions going down this path because I think there's so much there. But I had a specific thing I was hoping to get to in this, and I'm like, I feel weird kind of pulling back to it, but I'll verbally acknowledge the segue. I want to go back to some of the things you started with a little bit ago. You said when you came in, your mandate was we're growing, get us ready for that. And so you talked about getting the right payroll tools in place to support people in multiple states, talked about the need to put together leadership development programs to be able to grow people internally to take on those roles, things like that. Those are examples of some strategic moves. What are some of the other ways that your HR sort of evolved or changed as you hit these milestones and grow? When you went from 80 to 250 to 500 plus, as those things that changed, how did your focus as an HR team change?
I would say, I'm going to start with twofold, but something else may pop up. I would say one of the big things that came as we got between that 200 and 300 mark, I love training. I love presenting. I love facilitating. That is one of my first loves when it comes to HR. So I hired an amazing director of talent development, but she had to pry training out of my cold dead hands almost because I love it so much. But she's amazing and she's done a great job with it. But I had to let go of training. I had to let go of my first love because I didn't have the time to put into it like I needed to. And we had to put more and better onboarding and training in place as we continue to grow. As we grew in complexity, adding more levels of care, we didn't have detox in the beginning. Detox is a whole thing in and of itself. That medical model brought a whole nother layer of complexity. Adding insurance and VA and all these other funders brought a whole nother level of complexity for our team. I didn't have the time to put into training and development. Like when I first came in, I could throw together a training deck and we'd record it. It'd be great. And we'd push it out. We're now doing that on the regular all the time. And things are always changing, whether it's regulations or whatever it might be. And so that was one thing that we had to put in place as a formal breaking out training and development as its own separate thing and learn how to let go a little bit, a lot. So that's one piece of it. And then the other thing too is we had this from the very beginning. Bill Bailey, our president and CEO, brought this structure with him from a former organization. But our strategic plan is built into 5 pillars. It's quality, culture, stakeholders, finance, and growth. From those 5 pillars, we bonus all of our staff. All of our frontline staff, individual contributors get something called gain sharing. If we hit those metrics I was talking about by facility earlier, those benchmarks, they get $1,500. And it comes after our November board meeting, after they accept our financial audit for the prior year, making sure that our books are all good. Then those funds are released and our frontline staff get $1,500. Our managers and above, they have goals that are linked back directly to our strategic plan. I'll give you an example. One of our items under our stakeholders is our client satisfaction surveys. Our clients are one of our biggest stakeholders. And it's great if we're making a lot of money, right? We have all these revenue streams, but if our clients aren't satisfied, if they're scoring us low on the groups or the curriculum or the food or whatever it might be, that is one of our benchmarks as well. Our benchmarks are our census, our client satisfaction, and then our financials. So those are our big numbers that our gain sharing is based off of. And so for stakeholders, our program managers who are in our facilities have oversight over the cooks. So their stakeholder goal is that client satisfaction on food is 85% or above. So their bonus dollars are tied back to a specific item on our strategic plan. So our goal system is set up to match those 5 items to the manager's job description, but also tie it back to the strategic plan. So by doing that, you are going to get bonused on something that helps us hit our strategic plan goals. But it's not something that's outside of your job description. So we're aligning our managers and their goals back to the strategic plan. So that helps us drive to our strategic plan, which is what our board approves that we're going to be focused on every year. So that was something that has really expanded, as you might imagine. It was very few managers when we first started. We only had 3 locations and we only had 1 service line, 1 treatment line. And as we've expanded, we've got more and more managers. And so now we're doing these goals for 60 to 70 people. And we're having to align them all to their job description, but all back to the strategic plan. So it's a little bit of an undertaking. It has grown over the years, but I do have some support from my senior manager of HR. She actually has her 10-year anniversary next year. I got her right out of college, and she is definitely one of our success stories. The one thing I always say is hire for attitude. Hire for attitude, hire for intrinsic motivation. If they have the skills, great. That's great. That's a bonus. But if it's someone who has a passion for the job, has a passion for the mission, and you need to do some training, if you have the time to invest in that person, all day long. And so she's been with me for 10 years, and she has grown from HR coordinator to generalist to manager, and now she's senior manager in the last 10 years. But those are the top two things I would say that has really grown and expanded over the last few years.
If I'm going to distill those two things down, help me make sure I'm on target here. Number one, it was your team expands. And so you have to be okay with handing things off and being able to do that. The other part, I bucket it as you need to codify and communicate the strategy in a way that everybody can understand. Because HR, if you're doing it in a bubble, who cares? It's not going to matter. It's not going to reach the impact. You're not really serving if you're making up your own rules. So that's what I got from you, is making sure you're codifying that, because you got to work on what does this look like when you're senior leadership? How's it going to flow down? And then getting it into the hands of those leaders so they understand it day to day, not just a value or something written on the wall, written down, but this is what it looks like physically for you. So you know if you hit it or if you missed it. Is that right?
Yes. And they report out on it monthly.
Okay.
So they're
accountability.
Tracking. They are tracking, and they know whether or not they're going to, and then we tie dollars to it. They know whether or not they're going to get that bonus or that portion of the bonus when it comes to the end of that fiscal year. And then the other thing I will say that goes along with that, and this is part of the way we've helped to manage culture as we've gone through so many mergers and acquisitions, the culture part of those 5 goals, all of our managers are actually rated on 5 core principles of our culture every January and so it's like it is a 360. Some of their direct reports, some of their peers, their supervisor. For our managers and above here at Facility Support Center, we actually have a few facility directors on each person up here. So it's not just, we're not just rating each other up here. The facility directors are our customers, so they get to rate us too. And that is tied back to the bonus for culture. So when we pick up a new location like we just did in San Antonio, as we bring them into the fold, they're going to become part of that culture survey. Now, the survey is only 5 questions. To me, these are what I would call pay to play leadership or management characteristics. The first question is, does this person consistently contribute to our mission? And the answer is consistently, which is 85% or above, somewhat consistently, 65 to 85%, or not consistently, which is less than 65%. So that's number 1. Mission is always number 1. Number 2, positive, respectful communication. Number 3, honesty and integrity. Number 4, effective team member, stepping in to support, but also knowing when to stay in your own lane. Sometimes we have a few of those. And then last but not least is role model professionalism attributes. Does this person respond to their emails, attend meetings on time? So just being able to role model those professional aspects of the job. And then depending on where they score, they get bonus dollars tied to that. So if you're doing what I'll call some of the basic things that you need to do as a manager or leader, that part of your bonus almost becomes a gimme. You have to score in the really high percentile to get 100%. So out of a total of 50 points, you have to be between 48 and 50 total points for the year to get 100%. So you need to be hitting it. And then the next is 90%, 80%, so on and so forth. What happens is people, if they get those lower scores, like down in the 18 to 20s, they either start, and the other thing too is it's not just a score. Regardless of what you score, you have to give feedback. Either what are the positive things that you see them doing in this section that you want them to continue? Or if you're rating them a somewhat consistently or not consistently, you must give them constructive feedback. You must. They deserve that. If you're going to score them lower, they deserve to know what you feel they are not doing consistently. And it's the feedback that adds the value so they can make changes and improve their score for next time. So we use the same participants in the survey in January, in June, so that way we can see, did they demonstrate improvement? And then we switch it up again next year for January and June. So that I think has really helped us to, number one, we do our due diligence on the front end to make sure it's going to be a culture fit. So that's first and foremost. And we have actually been down to the wire. Our board had approved, their board had approved. It was down to the wire, and they were just resistant on some things that needed to be changed. And we said, okay, then we're not going to move forward because this is what is going to be needed. We're not just going to continue to fill a 200K hole every single year because you don't want to make changes. So we're not going to tie ourselves to a boat anchor that's going to take us to the bottom of the lake, right? So they have to be willing to come to the table as well. But once we do marry and get into this relationship, then we tell them all along, these are what our core values are, our core culture principles, and this is how we execute on it. So they know that those surveys are coming and what the expectations are going to be of leaders.
This is a masterclass in taking something from a high level strategy and making it very relevant and practical and actionable to every person in the business, really making sure that everyone knows, because those managers, there's no, I didn't know or wasn't sure, or there's no lack of clarity there because you've put these things out, spelled them out, and tied comp to it. So they know they're leaning on it. It says like what gets measured gets done, what gets paid for is what often gets done too. And so you're incentivizing all the right things. I want to ask you one more thing. Again, rewinding just a little bit, because you mentioned this a minute ago, and like on a more professional or personal level, depending on how you want to answer it, when you're talking about your person you brought on to be a trainer and you had to let that go. I remember the same feeling I had when I would love doing parts of HR. We started adding people onto the teams we grew, and I had to let things go because otherwise it was going to hold me back from being able to do the other things that mattered. And I'm just curious, do you miss that? Or do you end up growing to find a new love, like brainstorming with that person on how to do their work better or seeing them grow and develop? Is it like I miss that? There's times you might feel that sort of pang in your heart, like I wish I was able to do that. Or do you start to find another way to appreciate and enjoy your work that's on a deeper level potentially?
So great question. I would say a little bit of both. I really, because one of my other passions, and it's probably a tie for which one I love the most, is developing people. And so when I am working with that leader and pouring into them, I feel so fulfilled that way too. One of the things that I've said, and I feel like we're doing this with our leadership development program, we do it when we acquire and give these smaller nonprofits opportunities to grow. And we did this with a consultant for our executive team, is walking through a half day of what are your values and what are this. And at the end of all of it is, what do you want your legacy to be? And so for me, I want to create an army of servant leaders. That's my goal. And so when I get to pour into this other leader who's maybe doing something that I really like doing, number one, I can see how much more effective she is. She actually has her PhD in organizational development. She is freaking amazing. So she's taken what I've done to very much the next level. I'm just in awe of her and how much she's been able to get done with one content designer and one like training coordinator. And she's just a force. Same thing with my senior manager of HR. She now has a employee relations and talent acquisition supervisor. We have an employee relations person. We have 2 talent acquisition specialists. And to see her lead them, oh my gosh, like that's lights out, right? It's lights out good, because to watch her come and grow and see what an effective leader she's become, that is just so rewarding. And this past year, and I'm not saying this for any other reason, but to share, I got promoted to chief of staff. And I got 2 new departments underneath me that I know nothing about: legislative affairs, and I know a little bit about development. And so our director of development and special events now reports to me, and our legislative affairs manager. I grew up really poor, so I hate asking people for money. I would rather give you my whole wallet, take it. I would rather give money away than ask somebody for money. But I'm learning as much from her as she is learning from me as a new team member, right? And she's a force. And so to me, it's about taking risk and trying new things. While it can be frustrating and scary, if you make yourself vulnerable as a leader, you're going to continue to stretch yourself. I'm in my mid-50s and I'm still learning. And I'm still learning from people who are much younger than me, but they are in their field and they are doing it, and they're bringing, I get to bring that level of expertise in. put some bumper rails on it, give them the historical information, and then watch them shine. And so the whole piece of people development, to me, that's just as rewarding as the training and development. I will say the way I balance that is I make sure I scratch that itch every once in a while on training. I have 1 or 2 training sessions that I insist on doing live every single month. And so it's basically 2 hours every single month that I get to do that. And I do some conferences and things like that where I get to go out and do it in public. But I do that here every single month. And one is called motivational interviewing, because I think our hiring is really important. And I don't want that to be a recorded training. I want to look at our staff, our managers, eyeball to eyeball, and make them engage with me. I don't want them to watch that on our training system and go through why we're doing what we're doing and why it's important, and give them specific examples and be engaged in that process. And then our other is our corrective action training for the same reason. Those two, I think, are so important to our organization that I want to look people in the eye and interact with them when that training happens. And I want them to hear some of the examples from me and the importance for me. And then at the same time, I get to scratch that itch too. So
thanks for indulging me. I was just curious. I remember that, again, remember the feeling myself. And then I get to see someone else flourish, and the same as you. So for anybody else listening here today, if you've enjoyed the conversation with Kellee, I'm going to put 3 links into the show notes of the episode. The first link will be to the last interview I did where you actually talked about, as you grew, here's when we added this person, that list of people on your team, that incredible group that's making all the people stuff happen at Cenikor. You talked about that growth, that journey, when you added them, what they do, and how you divvied that off. For anyone who's growing, it's a really great set of insights there. So that link will be there. I'll put a link to Kellee's LinkedIn profile so you all can reach out, connect with her, tell her how amazing she is, because you can tell she's amazing. And number 3, I'll put a link to Cenikor's website just so you can see what the team is doing over there and see the mission, some of the things that she's talked about, because they're helping people solve big problems and address big issues. And they're doing it in a very personal and connected kind of way. So Kellee, thank you again for being willing to share with us, for your passion for HR. I'm like all fired up just hearing you talk. And I've known you lots of time. I knew good things were going to come, and I'm still like pumped up because you're always incredible. So thank you for spending some time with us.
I will, if I could just do one more little plug. I want to make sure, because addiction and substance use, as you know, knows no bounds. And so along with the website, whether you're checking out what we are doing with our website, our careers, any of that, if anyone is having any issues with substance use, definitely the place to go, because if they don't have funding sources, we have funding sources, and we have beds, and we have capacity. So I think it's especially important this time of year to be thinking about that and seeing who we can support.
Wonderful. Thank you again, Kellee, for your time. And to everybody else out there, I hope you got some great notes. I know that I did. And we'll catch you again next time on We're Only Human.
Thank you so much for joining me on the show today. I'm honored to have you as a listener. If you enjoyed this episode, please take 10 seconds to rate it at iTunes, Stitcher, or wherever you listen to your podcast. Also, if you know a friend that could benefit from today's conversation, please pass it their way. After all, a rising tide lifts all ships. To see show notes, sponsor information, and our full show archives, visit onlyhumanshow.com.